The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
I'm Dr. Kachmann. Thanks for watching our show. This will be, I think, very interesting because what I speak mainly about is how to prevent, stop, reverse type 2 diabetes and its 50 complication. I'm certain that if it's not yourself, and you may not know actually that it's yourself, and some friend, somebody in the family that has this problem. Certainly in my family, there are people who have this problem who are in denial, delusion about it. The trouble with that is that type 2 diabetes, which is stoppable, preventable. If you got it, get rid of it. 30 days. Yeah, 30 days. If you eat nutrient-dense diet, exercise a bit, maybe 20% animal products, take a walk with your dog, you'd be rid of it 90% of the time in about 30 days. Don't you think that reeks of opportunity, opportunity, opportunity? So once a month I give a talk on this, and I thank Public Access TV providing me this opportunity. Look at my website too, kachmannhealth.com, kachmannhealth.com, because it's full of information. You can look at maybe 300-400 other YouTube shows I've done on health subjects, all free. It's all free to the public. I'm a physician, which means teacher. I'm trying to teach it to you, and it has tremendous effects on your life. So this show, and once a month I give a talk on this at Lutheran Hospital, and Kachmann Health is the schedule. Please look at our website frequently, please. It'll improve your life tremendously. If you don't do something about it, probably you'll have 30 years of disability, die 25 years younger. Don't you think that's opportunity, opportunity, opportunity? Okay? So let's go through some of the complications of type 2 diabetes, and that's the main reason for doing it. It's got 50 odd diseases associated with it. Unannounced heart attacks, strokes, blindness, liver transplants, kidney transplants. I can go on and on. Avoidable 90% of the time, not that hard. Okay? And type 2 diabetes is a leading cause of blindness. I mean, just close your eyes a minute, close, so you see what blindness is. You want to lead your life like that? Come on. Keep them closed for a minute. You want to lead your life like that? You between ages 20 and 74. You could be blind at age 40 from type 2 diabetes. Many times the disease starts at a teenager. You get a teenager with a pot belly, probably pre-diabetic. If this doctor says he isn't, he's been running the wrong test. Yeah, he needs a glucose tolerance test with a serum insulin. You'll find that actually he is diabetic. Lose 10, 15 pounds, diabetes gone in a month. What do you think? Pretty good trade. Blindness is a big thing. And it has a lot to do with the retina, the microvasculature, the very small blood vessels affected in the eye, in the retina. Retinal hemorrhages, occlusion of blood vessels, microaneurysms, little tiny outpouching, little balloons outpouching that bust because of hemorrhage. I had a friend that had that happen recently. I doubt he ever played tennis with me again because it's 3 months out now and still 3D vision isn't any good. He's in his 70s, but that can occur in your 30s and 40s and even younger. The complications of type diabetes can occur as a teenager. So don't live in denial or delusion, which I find when you look around, and a lot of people are in denial and delusion. And so it's also the leading cause of end-stage kidney disease. Mm-hmm. Yeah, need to go on dialysis, and eventually a few years of that, which is a total pain, because you got to go, be dialyzed somewhere at a center or the hospital. Some do it at home. Catheters in your belly. In the early stages of that, I have a patient now that I was counseling, that he was at the beginning of end-stage kidney disease. Well, end-stage, usually stage 3 or 4, but he had a catheter in his peritoneal cavity. He started eating nutrient-dense way of eating. He cooked the way Dr. Furman says, quick fix by Dr. Furman. He only cooks out of that book. He has a smoothie every day. Guess what? He get rid of his peritoneal catheter. End-stage kidneys. I didn't believe that. No, I think that needs to be studied more. I have a feeling that these renal guys haven't been studying that. They get some people with starting to have end-stage disease. They see the progression on the laboratory test, and if they had patients, a little bit of weight loss, eat nutrient-dense food, exercise a little bit, maybe get rid of that disease. Has that been well studied? No. So it's interesting, this patient of mine that's going on now. And it's a cause, type 2 diabetes is the biggest, causes 50% of the amputations that we do. Mm-hmm. All from, what did I tell you? Vascular disease, inflammation, which is caused by elevated blood sugars. Causes inflammation all over the body. When I see someone that clearly is having a weight problem, they're probably type 2 diabetic. What I feel I'm looking at, they may have no symptoms. What I'm looking at is a body on fire. For some reason, I seem to see the fire. It's a burning body. Hmm? It's a burning body. And I tell people, you are what you eat. Yeah, to a point. You hear that all the time. You are what you digest. Okay. All right. But you actually are what your blood work is. Get your blood work. Run the right test. Remember I said serum insulin, maybe your CRP to indicate how much of inflammation is going in your body, a homocysteine, glucose tolerance test with serum insulin, lipid profile, your LDL, the low density LDL, the particle number and the particle size is more important than the big LDL. Yeah. The cholesterol theory is actually going down. It's a very low density LDL that counts the number, the particle size, because it's those little density LDLs that hit every crack and every bifurcation and forms atherosclerosis. That's the guys that you got to test for. And about 50 to 75% of dementia is caused by type 2 diabetes, because the sugar combines with proteins and forms advanced glycation, that's sugar, end products. And these are deposited in your brain to interfere with the nerve conductions, helps form amyloid bodies and fibrillary tangles that interfere with nerve repair, nerve conduction. And this is, they have now determined, and I can show you the graphs in Dr. David Perlmutter's book, right in there, graphs in there, that your brain size is dependent on your body size. Remember, type 2 diabetics, 75% of them overweight. Not all of them. We have the fat on the inside, the trophies, fat on the inside, but thin on the outside. So you are what your blood work is, but 75%. They've correlated now body size with brain size, MRI scans. You're way overweight, your HbA1c, that's 3 months of blood sugar, okay, is related to, if your HbA1c is 8 or 9, you get a smaller brain. They've shown it. Scientific proof. They've correlated also to belly size. Your belly measurement is related to your brain size. Scientifically proven. This is a judgment-free zone. Judgment-free zone. But I'm saying, I'm trying to motivate you based on science. It's right in there. The graphs are in there. The studies are in there. So it's based on science. So not to do anything probably will cut 30 years off your life, 25 years, maybe or longer be disabled. Amputations. I went to a funeral recently where the one died, had both legs amputated. One brother already had a leg amputated. Mother died of it. The minister looked like he had diabetes, and their father had type 2 diabetes. Then in denial and delusion, especially certain ethnic groups and racial groups, because in slavery, the slaves could have been white or black, doesn't matter, is because they weren't feeding them. No breakfast, no lunch. They gave them sugar cane. It changed their genetic structure. So they're running even a 90% type 2 diabetes rate. Look around the church. See what you're looking at, okay? See what you're looking at. As you walk in, what are they giving you? Donuts. What do they want you to go to heaven right away? Okay? Make you feel good. I'm in heaven while you're listening to the thing, but they're killing you. Is it denial, delusion? Is it on purpose? Remember the Bible says the body of Christ is within you, so you have some responsibility for your body. So to go there and feed you sugar, I think is inappropriate. Some realize that. I know of a church that changed that totally. So I thank them for it. I thank them for it. So tell the leaders about that, because I want you to live a long life. I want you to live a long, healthy life. Okay? But the good news is this is stoppable, preventable, reversible. Eat a nutrient-dense way of eating, foods of color. Have a smoothie every morning which has vitamins and minerals and phytochemicals that satisfy your nutrient need. Your appetite will stay down because you're eating the nutrients need to keep you alive. They followed a sheep one time with lots of food, and he stopped eating when he ate a certain plant. Why was that? Because the nutrient, I think it was magnesium, that was in that plant satisfied his nutrient need, stop eating. So that's part of the problem with eating processed food, because it has no nutrients in it, and we keep on eating to fulfill a nutrient need. In the meanwhile, we're gaining weight, getting diabetes, and 50 diseases. Fast food restaurants do that all day long. It's processed food. It's processed food, okay? So look at what you're eating. We all are neurotransmitters that we have in us. Every cell has an area there, receptors that neurotransmitters meet. I get up in the morning, everybody's a little bit depressed in the morning, I drink coffee. My neurotransmitters are happy and they're dancing and I'm feeling good. I take a walk in nature, I'm even feeling better. Other people light up a cigarette or eat some donut and eat sugary foods, and I feel great, but then the blood sugar shoots up and then it goes down and they feel down, okay? And that's the way the neurotransmitters work. A lot of us have diabetes fatalism. I'm a diabetic, it's not reversible. Oh, I didn't realize it's reversible. Here's your metformin. Come on, you may need that. But first you should try lifestyle. Rarely do the providers bring it up. I bring it up. You should bring it up. If they don't want to do it, you tell them, I want to get rid of my diabetes. Okay. Look at my website, KachmannHealth.com. The books, DVDs, TV shows that are on there. Point them out to your doctors to read the book. End of Diabetes, Dr. Furman. Blood Sugar Solutions, Dr. Mark Hyman. Goodbye Diabetes, Dr. Wes Youngberg. Read those books. Read those books. Simple to read. Get rid of it. Or if you decide I don't read, well, then maybe get Furman's Quick Fix Cookbook, cook that way. Do the smoothies. There's a picture of every recipe, what to eat, breakfast, lunch, and dinner. Do that for 2 months. Goodbye, diabetes. Wouldn't that be wonderful? Added 30 years to your life. Many years of that you wouldn't have disability, be healthy, probably live to be 100. Isn't that wonderful news? Man, I'm dancing. I'm dancing. You won't believe this one. Recently, talking about dancing. Yeah, I'm going to do it because I play tennis and pickleball already. But a month ago, I took up tap dancing. Okay, because you got to use your feet. I'm not getting younger. See what happens. But there's a if you say, I can't exercise, I can't run. Tap dancing you could do on a table like this. This little table, few feet, this little round table, you could tap dance. So don't tell me, oh, I can't walk, I can't. Well, take up tap dancing. Buy some tapes, look. I mean, you can watch all kind of tapes on Google that I don't think you put in tap dance, and you can watch YouTube and different shows forever. And if you watch by a DVD you don't even need a teacher. I do both. I have a teacher and I read DVDs, but it's a lot of fun. A lot of exercise, music. It reduces stress. I don't eat anywhere near as much as when I'm doing that. I'm not grabbing the sugar to make me feel good. So I do want you, don't be apathetic. Don't be in denial. Start reading. Look at the website. Educate your providers. A lot of providers are just about scripts. It's just the way it is. I try to change it. I've been there. I've been to the diabetic clinics. It's just a road to nowhere. They're very good with medication and stuff. And to keep a normal blood sugar will reduce the rate of these complications, but you still have the disease. You still got it, and you will die from it. Matter of fact, they found keeping the blood sugars normal with medication does not lengthen your life. Yeah. Does not lengthen your life. Scientifically proven. You want a longer life, you do what I'm telling you, and you'll have a longer life without a disability. Not every case, 90% of the time. Okay? Don't accept abnormal blood sugars. Okay? Complacency. And try, maybe don't stop the medicine because of what our recommendations. Work with your doctor. Try the healthy way, and then follow your blood sugar, check more commonly, tell your doctor this is what you're doing, and as they drop, get off the medicines. Insulin is anabolic. Insulin puts sugar in the cell for energy, ATP. You may need it if you make no insulin, okay? But it also makes people fat. It's anabolic. It stiffens your artery. It causes dementia, increased rates of cancer. Insulin does a lot besides putting sugar in the cell, about 9 other things. Yeah. So it deposits ages, advanced glycation end products in your joints. Yeah. It slows your brain down, causes inflammation all over the body. It may save your life for a period of time. Your blood sugars may be normal for a period of time. Incidentally, half the people don't even take the medication, which of course is very dangerous. But I say push the extent to the way you can get off medication. Okay, see if you can get off of medication. I know people got pumps in them. They help people a lot. Pumps help a lot. But I know of a kid who just eats anything he wants to and just increases the amount of insulin in his pump, and he's this size. He's not going to lead a normal life. He's going to die young. But if you follow the lifestyle very close, and if you're type 1 diabetic where you make no insulin, you can live to be 100. But you still got to follow the lifestyle. Yeah. The ones type 1 diabetics on average die in their 50s. They could die in the hundreds if they followed the lifestyle. The lifestyle is not pushed at them. I'm pushing it. I'm pushing it. So announce it. I can get rid of my diabetes. Say it every morning. It's more likely to happen if you tell your brain, I'm going to get rid of my diabetes. No one's perfect. You're going to eat the wrong thing. You're going to grab a donut. That's okay. All right? Just don't do it every day. And develop new habits, new things. Walk in nature. Take up dancing, whatever. Something to reduce your stress so you won't be a stress eater. And you'll find that once you detox from sugar and not eat so much of it, you'll find you won't want it. Even myself, I can go to a restaurant now, and believe it or not, the dessert tray could come by. They tempt you with the cue. Did you see it? Most of the time I pass on it. Not every time. I mean, there's certain days that I might grab for it, but at 134 pounds today, I think I can afford it. For one thing, I already walked in nature. Actually, not this morning. We'll do it later today because I got up too early for the show. I'll be doing some tap dancing rehearsal and probably stop at Planet Fitness and work out for an hour. I mean, that's my typical day. You don't have to do all that. Just a walk, walk the dog. Or do you exercise at work? You get no time. Do it at work. Get a stand-up desk, get a treadmill desk. And if you can get your exercise done at work, that's the best. You come home, I already did my thing. Huh? Yeah, it can be done. People do it. So whatever motivates you. I have an interesting story to tell at Planet Fitness, which I like. Cheap, $10 a month or something. I don't know if they changed it recently, and people ask me for advice there. They don't allow me to run their tapes, which I like to. They don't let me do that because of the franchise. But people will ask me in the locker room what to do. I had a guy, I came in one Saturday. Incidentally, they get like 30,000 members. You know what percent exercise regularly? I asked the people at the front desk. 10%. 10%. And they're motivated to go there in the first place. So what percent of the people exercise regularly? 3% maybe. Yeah. So I'm not dependent on that, but activity of living. Increase your activity of living. AOL might be the best way to deal with this. Walk the dog, or do it at work, or stand up while you're on the phone. That triples calorie burn. When you stand up, it triples calorie burn. And those activities of living, if you can increase these 200 extra calories per day you're burning because of increased activity of living, that's 20 pounds in a year. You have 3,500 calories per pound, 365 days a year. That's 20 pounds in a year. Yeah. So if you feel like I got to lose 20 pounds, that'd be an easy way. Increase your activity of living. If you eat the right food, vegetables and fruit, for example, they're full of water. And maybe you'll absorb 40% of the calories because they're full of water and fiber. If you eat mainly fatty foods, 96% will sit in your belly, your butt within 4 hours. You see the difference? Okay? So the type of food affects you too. So let's avoid these diabetic complications. There's a very good book written by Judy Curtis, Living with Diabetic Complications, but that's not really what I want. I mean, sometimes you have to live with them, but most of them could be avoided. I want you to get rid of the disease. It can be done. You gotta accept that, okay? But with diabetics, speaking more a little about the eyes, affects the microvasculature, hemorrhages, aneurysms, but increased rates of cataract and corneal problems also with diabetic because of inflammation and the deposit of advanced glycation end products, for example, in the capsule, causing increased cataracts. About 12 to 24,000 people become blind every year from diabetes. Yeah, remember I said cataracts, glaucoma, retinal changes too. People can develop high blood sugar crises and low blood sugar crises because the insulin level is going up and down. You forget to take the medicine, you ate the wrong food, you didn't test enough. A lot of people don't even test, don't take the medicine, they don't test either. Can you imagine? Just think, I have counseled truck drivers. They have a very sedentary lifestyle. They're trying to make a living. They can't help it. But most of them overweight. Most of them got pot bellies. So what do you think the average blood sugar is of truck drivers driving down the road? It scares me to death. I bet most are 300-400 because they stopped at a truck stop, ate that lousy food, then go on the road an hour later. What do you think their blood sugar is? 300-400. Yeah. And this huge semi is driving next to you. Government law allows them to, they need to keep their HbA1c, I think it's 8. My God, if you had an HbA1c of 8, you're big time type 2 diabetic. You're running blood sugars, high blood sugars, the majority of the time. Our government allows people with high blood sugars drive down the highway, the trucking people, no less, non-trucking people. Yeah, just imagine that, and the how dangerous, that is. So we have hypoglycemia, dizziness, fainting, passing out, seizure. Hyper, people sometimes want more water to drink, and you can check for ketones that are made by the liver in your urine. Is more commonly seen with hyperglycemia ketone testing. So you got to learn to check for too high blood sugar, too low blood sugar. Can you imagine at 3 in the morning, if you ate a whole bunch of sugary food before you went to bed, ate a dozen donuts, what's your blood sugar going to be like at 1 or 2 o'clock? Man, oh man, 40 or 50, because the insulin gets secreted to meet the sugar, and then the sugar dies down, and here you are laying in bed with a blood sugar of 40 or 50. You could have an unannounced heart attack. That occurs commonly. Unannounced heart attacks commonly in hypoglycemia. So in summary, what am I really saying to you? Don't live in denial and delusion, okay? Get rid of this disease by doing some reading. Maybe just learn to eat right. Quick fix, Dr. Furman. You get rid of it in about a month or so. Attend my lectures, watch our TV shows, and work with us. No longer accepting the disease. Just handing you a prescription. Here you are. See you in a year. Don't accept it. Don't accept it. Why am I so passionate about it? Because 1 out of 2 people out there is pre-diabetic. There's some restaurants I go into that I eat breakfast. I'd say 90% of the people are pre-diabetic or diabetic. Some come in a wheelchair. Some are amputated. Some got no idea they get diabetes. It is very serious out there. And that's the reason I do this, because I love you, care about you. So I get TV, public access, websites, books, other books, teaching, a little bit of passion. I don't have the problem. I want you to be well. I want you to live to be 100. But you can't deny it. You have to act on it. And if you can get a friend to help you, that's helpful. If you have someone in the family and you're not the one that's sick, but they're sick, become their friend. Hug them. I love you. And educate them. That would be the best way. Many people come up to me when I go to Starbucks or someplace, have a cup of coffee, they come up to me. I got rid of my diabetes. And that truck driver I told you about at Planet Fitness, he went from 360 down to 210. And he said, you gave me a talk on this a year ago. We was from California. It's a true story. I have a picture of it on my phone. Ask me to show it to you if you see me. So it can be done, 360, 210, just following a nutrient-dense diet, diabetes gone. He has a crock pot in his truck. So when he gets there 10 hours later, he has some chicken and vegetables, slowly cooked, 120 degrees or under, keeps vegetables and beans and fruit in his car, rid of his diabetes, rid of medication, maybe the only truck driver in the country. No, I doubt that. But it's a wonderful story, and I share it with you. And I hope you keep on watching our shows here, and because I can get rid of this plague on your back. It's a plague. Remember, I talked about unannounced heart attacks because of hyperglycemia, vascular disease. Dime a dozen. And I think it actually happened to somebody that bought my Lake Cottage in Lake Wawasee for me. Just looking at them, I thought they probably wouldn't live long enough for them to fix the house. It's exactly what happened. True story. And I don't know if that's what they had, but they were found dead in bed. Okay? That happens commonly, this kind of thing. I'm not saying that was the answer, but it could be. So I love you all. Namaste. Physician means teacher. I'm trying to teach you. And namaste.